All right, good afternoon, everyone. I'm happy to welcome everyone to this public engagement co-sponsored by DEED and the Minnesota Hospital Association. I want to first welcome MHA member hospital and health systems as we have collectively as Team Hospital continued to talk about this piece of legislation and coming program starting January 1 since it was passed into law into 2023. Since this is a public webinar, I know there are other healthcare providers on the line. And so I think I will represent all healthcare providers when I say that uniquely Team Healthcare Provider is going to have a unique role in paid leave, not only as employers, but also as medical providers certifying medical leave. For hospitals and health systems, the scale of this is going to be extremely large, and with our requirement to provide 24/7 care, the aspect of that overlaying with this program and delivering care at that type of level is going to be a unique challenge. One that we are grateful to have more information on today, specifically on the certification of medical leave. So I know that many on the line have been working with DEED's paid leave team, which I will be introducing Mr. Greg Norfleet in a moment. So I know that this is an important piece of information that's going to help zero the distance between where the medical community and healthcare community is today and where January 1st is marked on our calendars as the start of this program. So we're looking forward to having more information today. This is going to be a great start to provide more room for follow-up as we approach that January 1st date. And we're looking forward to and grateful for the engagement that DEED has provided thus far. So with that, for everyone on the line who just looks at the website or sees the emails, Greg Norfleet has been the leader of this paid leave team, and he has some experience coming out of Massachusetts. And so he comes to this role with nearly a decade of experience in state government, with a focus on delivering high priority initiatives for state leaders. Critically, as I just mentioned, he led the implementation for the Massachusetts paid leave and medical leave program, which the Minnesota program is modeled after, along with Washington State's. So that launched successfully in 2021 in Massachusetts. So we grabbed Greg from Massachusetts and brought him over to Minnesota, and now here we are. So since moving to Minnesota in late 2023 for this, Greg has led the creation of the new paid leave division at DEED that has been tasked with launching our state's own paid leave program this January. And again, that is we are again grateful for this opportunity to have this first look at the medical certification process, and I'm looking forward to some great engagement from our members and other healthcare providers on the line today. So with that, I'm going to turn it over to Greg and Danny.
Hi there, everyone. I am the other Danny that will be helping facilitate today's webinar. I am part of the public engagement team for Minnesota Paid Leave. And we're thrilled so many of you can join us today. We have about 276 people and counting online with us right now. So at today's presentation, we'll explain what Minnesota Paid Leave is, and we'll talk about things like who's eligible to take paid leave and for what, how paid leave coverage compares to FMLA, and what responsibilities providers and employers have when it comes to paid leave, and more. We also have a lot of information on the website, info.paidleave.mn.gov. My colleague will put that in the chat as well, info.paidleave.mn.gov. That includes FAQ pages for providers, employers, and employees. I'll also note that today's slides will be sent out and posted on our website soon as well, and you'll be able to find them on our public events page. This webinar will also be recorded for training purposes, and should we decide at a later date to make the recording public, a link will be posted to our website on that same public events page, and all registrants will be notified. Additionally, we send out monthly email updates about paid leave, which most of you signed up for when you registered for this webinar. But if you didn't, or you're not sure if you did, go ahead and sign up on the website. You can find all the links I just mentioned in the chat. Thanks to my colleagues for hosting that. All right, so like Danny mentioned, today we're joined by Greg Norfleet, Director of Minnesota Paid Leave. We're going to start with a presentation from Greg, followed by a Q&A session. Here's how the Q&A works. So you can submit your questions to us using the chat button. You can find the chat button at the top of your screen. It is a purple speech bubble with a question mark on it. There are two tabs in that chat, the Featured tab and the My Questions tab. You can check the Featured tab to see announcements like those links from our team. And then you can use the My Questions tab to ask a question anytime during the presentation. Only you and the Paid Leave webinar team can see your question about the program. Other attendees cannot see your question. Our team behind the scenes will be reviewing and moderating the questions leading up to the Q&A session. So if you have a question about your unique, individual, highly specific circumstance, or if we don't get to your question, go ahead and contact our contact center. They're ready to help you anytime. My colleague will put their contact information in the chat. There's an online form and a phone number you can call. All right, that is enough housekeeping from me. It's time for the presentation, so I'll pass it on to our presenter, Paid Leave Director, Greg Norfleet. Take it away, Greg.
Thanks, Danny. And thank you, Danny, and the Minnesota Hospital Association for setting us up today. We're so thankful for the opportunity to talk with certifiers, with healthcare providers from across the state. And we're really cognizant of the role that Danny mentioned in his opening remarks, that you're not only healthcare providers, you're also large employers and advocates for your employees. So you're a really important population to us to get right for January 1st. And we hope that this is part of a longer conversation where we can continue to build the best healthcare provider experience possible. Today, we're going to be focused first off on kind of comparing and contrasting paid leave to something that's going to feel familiar to a lot of you, FMLA. Our program, much like FMLA, offers job protected leave to individuals when they have a qualifying condition. But there are some key differences that you should be aware of, and we want to make sure that those are clear for today, and how certification is the same and how it's different between the two programs. So why don't we jump in with first understanding how paid leave coverage compares to FMLA, who's eligible to take leave under this program, and what are the benefits and job protections like under paid leave. So to start off with, the paid leave law was enacted in the 2023 legislative session and updated during the previous two. And what it did was it created a paid family and medical leave insurance program. And that insurance program is going to start offering both job protected leaves and partial wage replacement to individuals that qualify starting on January 1st, 2026. Now, for folks that are familiar with the Family and Medical Leave Act that was passed in the 90s, it's a federal program that offers job protection for people when they need time off for qualifying conditions, whether it's medical leave or family leave. And in all cases under FMLA, there are certification requirements where a healthcare provider needs to sign off that the individual requires leave because they're unable to perform the duties of their job. Our law is just like that. It has a lot of the same similarities. We also provide job protected leave for qualifying conditions, and medical providers will sign off to make clear that that individual cannot perform the duties of their job. However, one of the big difference of paid leave versus FMLA is that paid leave is paid. We're going to also be providing partial wage replacements to individuals while they're on a qualified leave. This means that, unlike under FMLA, folks don't have to make a decision at this point between financial security and being there for themselves and the people that they love. Our program is also broader in coverage, eligibility, and job protections than the federal program. Here's what our program looks like on a slide. Paid leave is really paid family and medical leave. And there's two lines of coverage, medical leave and family leave. Medical leave is exactly what it sounds like. It's time off to care for yourself when you have a serious healthcare condition that's going to keep you out of work for an appreciable amount of time. In order to qualify for a leave under the program, the qualifying event has to last at least 7 days and in all cases needs to be certified by a healthcare provider. This isn't for day-to-day absences necessarily like a program like ESST. It's more for something that's going to require either inpatient treatment or recurring care in order to keep you out of work for a longer period of time. So that's medical leave. It's time to care for yourself. Family leave is a little bit broader. It includes time off to bond with a new child, whether they've come to your home through birth, foster care, or adoption. Time to care for a family member with their own serious healthcare condition, as well as providing support to survivors of domestic violence and sexual assault, and to members of our military during an active duty deployment, whether domestically or abroad. The paid leave program offers up to 12 weeks of medical leave or 12 weeks of family leave within a benefit year. A benefit year is an insurance term, and in our program, it means a 52-week period starting on the date of first absence and rolling forward. So during that 52-week period, your patients will be eligible for up to 12 weeks of medical leave or up to 12 weeks of family leave. For OBGYNs or other doctors that support birth-giving parents, those patients may be eligible for both medical and family leave. In the case where somebody is giving birth, they may need either prenatal or postnatal care to recover from pregnancy, and that would fall under the medical leave bucket. After they've recovered from the pregnancy, they could then transition into bonding leave to welcome the child into their home. In those cases, instead of being eligible for both 12 weeks for medical and for family leave, the patient would be eligible for up to 20 weeks in total between the two leaves. What that would mean is a patient could recover, for example, getting 6 to 8 weeks for medical leave following the birth of their child, and then take the full 12 weeks of bonding leave. However, if they need more than 20 weeks within 1 year, they would not have access to additional leave above and beyond that level. Now, let's take a look at this compared to coverage under FMLA. In some ways, both programs cover medical leave for a lot of the same qualifying conditions would qualify. If it qualifies under FMLA, it would qualify under paid leave. Same with bonding leave. Both programs, both the federal program and the state program, offer new parents the ability to welcome a child into their home. Military leave, same deal. Caring leave, also, but safety leave is a bit different. This is a new line of coverage that isn't covered under the paid leave program, or that isn't covered under FMLA, but is covered under the paid leave program. Additionally, the folks who are covered under the programs differ. So under FMLA, in order to have access to job protected leave, you need to work for an employer of a certain size for a certain amount of time in order to be able to access that benefit. The qualifications are that for private employers, you need to work for a business that has 50 or more employees within 75 miles of their workplace for 20 or more weeks during the year. Covered employees usually have to work for at least 12 months and worked at least 1,250 hours or more within that 12-month period. Our program is a little more generous. Instead of, it applies to both large and small businesses. Regardless of the size of your business, if you're a practice of 10 or a practice of 10,000, you're still covered under the paid leave program. And as we'll talk about, job protections kick in after 90 days of employment rather than after 12 months. But most employers and most Minnesota employees are covered under the paid leave program. This includes employees that may not be required to participate in other programs. So even employees that are employees and employers that aren't required to participate in programs like unemployment insurance or earn sick and save time, they are required to participate under the paid leave program. No matter how much or how little you work for an employer, those hours and those wages are likely covered under paid leave. This includes if you're working full-time or part-time, picking up shifts occasionally, whether you're a temporary worker or an intern. It also includes employed family members, first responders, owner officers of an S Corp, and folks that aren't otherwise required to participate in certain state and federal programs are still covered under the paid leave program. It's a fairly safe bet that if you're performing services in the state of Minnesota, that you're covered under the paid leave program. The only exceptions are for self-employed individuals, independent contractors, and tribal nations. These groups aren't required to participate in the program, but they're able to opt into coverage if they choose to do so. Now, we are a state-funded program, which means that we're not able to offer coverage to federal government employees or employees of instrumentalities of the federal government. So railroad workers and the post office are unfortunately not covered by the program. There's also a very narrow exclusion for certain seasonal employees. This exclusion is extremely narrow, and it only applies to businesses that are, number one, seasonal in nature, meaning that they earn 2/3 of their gross receipts during 6 months of the year. And number two, in hospitality, meaning that they run a resort, a restaurant, a hotel, or similar business. If both of those tests are true, and then the employer has employees that work less than 150 days during a calendar year, those employees may be designated as exempted from the program. But this is a very narrow exclusion, and it doesn't apply to other seasonal workforces like agriculture. I think the big takeaway here is that the paid leave program is extremely broad in its coverage, and almost all workers in the state are going to be covered under our product. One area that is important to dig into is whether or not, if you have employees or patients that are working in multiple states, whether or not they are covered under the program. What this gets to is a concept called localization, and it's where it's basically determining where your taxes should be paid. And the test here is actually fairly simple. It's where are you physically working most of the time? So if you're spending 50% or more of your time working in a single state, then your work is localized to that state. So if you are spending 50% of your time, 3 days a week, every week, working from Stillwater, and then 2 days a week working in Hudson, Wisconsin, you would still be covered under the paid leave program because 50% of your time, you're spending it in the state of Minnesota. This has some implications for remote workers, where even if you work for an employer that is located in a different state, if you're working remotely from Minnesota most of the time, then you could be covered under the paid leave program. The inverse of this is true as well. If you're a Minnesota employer and you have employees working remotely from another state, those employees are not covered under the paid leave program because they're not physically performing services in the state of Minnesota. Now that should take care of most situations. But if you have an employee that spends time in more than two states, so they spend 1/3 of their time in Wisconsin, 1/3 of their time in Iowa, and 1/3 of their time in Minnesota, then and only then does it matter whether or not they live in the state of Minnesota. So in that case where you're spending, if you don't spend 50% or more of your time in a single state, then if you live in Minnesota, you'd be covered by the law. A couple of scenarios just to kind of help make this concept feel a little more concrete is if you have a business that's located in Wisconsin or located in Minnesota, but some of your employees live in Wisconsin, you actually won't know if they're covered because you need to know where they're physically working. So even though the business is located in one state, the employees live in another, the test doesn't rely on that. It relies on where the work is physically being completed. For the next test, a business is located in Iowa, but some of their employees work remotely in Minnesota. Knowing that they work remotely in Minnesota, you know that they are covered under the law because their work is physically happening within the state. In this last one, I work in multiple states, but I live in Minnesota. It's a highlight just to make sure you're applying both tests. It depends on first, even if you're working in multiple states, are you spending 50% or more of your time in one of them? If so, your work is localized there. If not, then and only then does it matter if you're a Minnesota resident, and then you would be covered under the state paid leave program. So that's who's covered under our law. Let's talk a little bit about what it means. So when you're covered under paid leave, you're going to be eligible for both job protections and partial wage replacements. Now, these employment protections are chiefly managed under the Department of Labor and Industry, and they feel a lot like FMLA. One of the major differences is that our job protections apply to both large and small businesses. Additionally, our job protections, as I mentioned earlier, instead of kicking in 12 months following a person starting with a new employer, these job protections kick in 90 days, or job restoration provisions kick in 90 days from the date of hire. So if an employee has been working for 3 months before they go out on a paid leave, they need to be restored to the same position or an equivalent position that they had prior to leaving. Additionally, employers are required to continue to fund healthcare and group insurance premiums at the same rate that they were funding it prior to the employee going out on leave. That's similar to a requirement under FMLA. And much like under FMLA, no retaliation or interference is allowed. However, there are state provisions above and beyond FMLA that include potential fines, potential penalties for employers that retaliate or interfere against an individual who is attempting to access benefits or leaves under the program. Much like FMLA, when somebody goes out on leave, they can take it in one of two ways. They could take it either continuously, which is leave taken all in one block, or they could take it intermittently, which is smaller blocks over a longer period of time. Unlike FMLA, our program does not have an explicit employer reject or denial for intermittent bonding leave schedules. So while an employer is able to deny, has been able to deny an intermittent bonding request under FMLA, that same right doesn't exist under the paid leave program. However, an employee is required to make a reasonable effort to not unduly impact the operations of the employer. And we do expect that employees and employers have a conversation about leave and leave schedules prior to coming to apply for leave from the division. That's the leave part of paid leave. Let's talk a bit about the paid part. So unlike one of the biggest differences between paid leave and FMLA is that when you're out on a qualified leave, you could be receiving payments from the state. These payments are based off of what the employee was earning prior to going out on leave, and they're awarded on a progressive scale. The real math behind this is that wages between 0 and 50% of the statewide average weekly wage are replaced at 90%. Wages between 51 and 100% of the statewide are replaced at 66%, and wages above that are replaced at 55%, up to a maximum benefit that's equal to the statewide average weekly wage of $1,423 when we go live. That math may not be totally intuitive, so for both employers and employees, we do have a calculator available, which we'll put into the chat, where you can see what this benefit would look like for you or for your patients when you're making the decision on whether or not to take leave. The reason why this progressive scale exists is really to allow low-income workers to be able to afford to take leave and not have to choose between financial stability and being there for themselves and the people that they love. Now, in order to qualify for partial wage replacements during the leave, there's an earnings threshold. That earnings threshold is 5.3% of the statewide average annual wage, and you have to have earned that during the previous 4 completed calendar quarters. That number is $3,900 when we go live in 2025 or 2026. That $3,900 could be earned from one employer or from multiple employers. So if you have more than one employer during the course of that time, all of those wages count towards your financial eligibility. If you only are working a few hours for an employer, even if you're only picking up shifts occasionally and only are earning $1,000 from one employer, those wages are still subject to paid leave premiums, but the wages that you've earned do count towards your financial eligibility across all the other employers that you have during that year. So it's a fairly low threshold to entry for individuals to be able to receive at least some partial wage replacement while they are out on leave. I will mention that if you are receiving payments from unemployment insurance, workers' compensation, or Social Security disability insurance, these are prohibited payments under our law, and we can't make a payment from the paid leave program at the same time for the same reason that somebody is out on one of those programs. So we will ask employees whether they're receiving benefits from any of these programs as part of the application process, but we'll also be validating that using our own administrative data behind the scenes. These premiums, they're funded much like private insurance our program, our benefit is funded through premiums. And those premiums are split between an employer portion and an employee portion. When we go live, the initial premium rate is going to be 0.88% of wages up to the Social Security cap of $176,000. By default, an employer is able to deduct up to half of that amount in order to fund the employee portion of the contribution. So for a large employer, they can take up to 0.44% of employee wages in order to fund that portion of the contribution. Small employers have a reduced premium rate under our program. Those small employers are employers with 30 or fewer employees where the average employee earns less than $107,000. If an employer is in that group, they'll be entitled to a lower premium rate, which is 0.66% of wages. However, they're still able to deduct up to 0.44% of employee wages to fund their portion of the contribution. So the reduced employer premium is really a reduction on the amount that the employer pays, not the employee. I will note that you'll start seeing, or you should be set to start doing payroll deductions on January 1st of next year, and that the first premiums aren't due until April 30th of that year, and that will be based off of wages paid between January 1st and the end of March. Now I want to shift a little bit into thinking about the identity of healthcare providers and hospitals across the state. We know that you have both a perspective as an employer and as a provider. Today, I want to dig a little bit into what that role looks like as a provider, as a certifying party under the program. And we really separate this into three major things. Being able to certify leave, where you're going to assess whether your patient qualifies for paid leave and fill out and sign certification forms in order to help them access the benefit. Educating and informing your patients about the program by providing resources to them so that if they have questions about the program or that they haven't heard of it before, you're an excellent vector for being able to inform folks about the availability of this benefit. And then lastly, being prepared as a large hospital, as a large employer. And there's three major things that we want you to do to prepare as an employer if you haven't already done so. The first is making sure that you set up your accounts with us in order to be ready for January 1st, that you notify your employees about the program, and that you update your workforce policies in ways that can make paid leave customized to your particular business so that it becomes an asset to you and to your employees. Let's start in the first area, and this was an area that Danny previewed earlier about what does it mean to certify leave under the program. like we mentioned, our program has a lot of similarities to FMLA, and it also, one of the things that it shares is the need for certification of a qualifying health condition or other qualifying event. When we think about certification, it's information that shows that an individual needs paid leave. For healthcare providers, we're particularly concerned with making sure that healthcare providers are able to sign off on the need for leave related to medical leave and for caring leave. Military family leave, bonding leave, and most cases of safety leave use other documentation for certification that's a little bit different than what we're talking about with medical and caring leave. When we're talking about certifying parties, you'll see under FMLA, they have a distinct list of individuals who are able to complete certification documentation on behalf of a patient. I'm not going to read all of them, but you can see them on the left side. Under paid leave, anyone who is already completing paperwork or completing certification documentation for their patients under FMLA is able to do so under the paid leave program. Additionally, licensed alcohol and drug counselors, licensed midwives, and mental health professionals are also able to certify the need for paid leave, while they may not be able to certify the need for FMLA. Under safety leave, we have a whole part in our rules that lays out social service providers and legal professionals that are able to certify specific types of leave and situations where somebody may need that type of leave. We're going to go through each type of leave in a little bit of detail, but beforehand, just as a large kind of framing concept, we want to make certification as simple and straightforward as we can. And we're also committed to continuing to improve this process over time with all of you. The paid leave certification forms that we're going to be publishing in the next 2 weeks are modeled after FMLA, so that providers don't have to learn a whole new process, and we're leveraging what already exists within healthcare providers' businesses. In fact, for conditions that qualify under both FMLA and paid leave, we will accept the existing FMLA forms in order to certify paid leave. You won't need to fill out both an FMLA certification and a paid leave certification, just one for both programs. We don't take a position on whether or not you fill this out on a computer or you fill it out by hand, but we will ask for information about your licensure and making sure that you are a healthcare provider that's able to certify that this individual does need leave under the program. After the certification form is filled out by the applicant and the certifier, they can be uploaded as part of the application. They can be faxed to us, they can be mailed to us, they can even be emailed to us. And we're continually working to make this process better and more accessible over time. So the way that these forms are structured, much like the FMLA form, is that the first section of the form is meant to be completed by the applicant. This includes just general information about who they are, who their employer is. They also may take a first cut at saying what type of leave they think that they need. But then, as the healthcare provider, you review that and you will need to fill in information about, confirm information that's provided about the start date, the length of the condition. We're specifically not asking about the diagnoses, but we are asking for your determination of how long the individual is going to be out on leave or is not going to be able to perform the duties of their job. The length of time, the schedule needed, whether it's a continuous or intermittent leave need. Medical facts, specifically what about the condition prevents an individual from being able to perform their regular job duties, not the specific diagnosis. Their essential job functions that are affected, the type of leave that's needed, and your professional and contact information. When we look at serious healthcare conditions, filling out certification for a medical leave, like we said, we will use the DOL form, but we're also going to publish our own form in the next 2 weeks that could be used if somebody would only qualify under paid leave. We don't want healthcare providers to need to fill out multiple forms for the same leave. Like we mentioned during the overview of the program, in order to qualify for leave, the underlying condition needs to last at least 7 days, and it needs to require either inpatient care or continuing treatment or supervision. Although these days don't need to be continuous, the treatment itself needs to last at least 7 days in order to qualify under the program. You can certify any physical or mental condition that meets these criteria, as long as it falls within your designated scope of practice. We don't specifically define or exclude any diagnoses as being qualified or not under the program. Rather, we're relying upon the expertise of the healthcare provider to say that in your professional assessment, your patient needs this leave. You may have an employee, or you may have a patient that's incapacitated or incapable of completing part of the certification themselves or applying to the division. In that case, we do have a process in place for authorized representatives who would be able to apply on behalf of an applicant. That authorized representative can help them apply for paid leave and navigate any hearings or appeals. This is something that's accessible via our portal, but it looks a lot like a POA, a power of attorney agreement, that this person is acting on behalf of another person has been approved as their authorized representative. We will note that minors and people under guardianship or conservatorship are not required to have an authorized representative, but they may choose to do so. So we covered medical leave. What is required, it's going to look a lot like FMLA. Bonding leave, which is the time to welcome a new child into your home, whether that's through birth, foster care, or adoption. I will note that both parents can take leave. Both the birth-giving parent and the non-giving parent is entitled to up to 12 weeks of bonding leave during that 12-month period. The way that we're going to be certifying bonding leave, there's not a designated form for bonding leave specific. Rather, bonding leave for birth is certified with hospital discharge papers, a birth certificate, a letter from a healthcare provider. If a hospital wants to set a standard of offering 6 weeks for vaginal, 8 weeks for cesarean, it's totally up to them. But they could put that into, or that's for the medical leave, my bad. Sorry. So on bonding leave, we just need documentation that proves that the child has been welcomed into the home, whether that's discharge papers, birth certificates, or a letter from the healthcare provider. What we're looking for in that letter is the child's name, the date of birth, the parent's name, who's going to be able to take leave, and a provider's signature. So that's in the case of birth. If it's through adoption or foster care, we'll use other documentation from the adoption or foster care agencies in order to prove the child was welcomed on a certain day. Caring leave. This is time off to care for a family member that has their own qualifying condition. This is very similar to what is offered under the federal FMLA program, but our definition of family is broader, which we will talk about in just a minute. In order to certify a patient or an individual for caring leave, this certification is coming from the healthcare provider of the individual who needs care. That certification looks a lot like what you get with the medical certification. The only addition is a section that has who is authorized to provide care, what type of care are they going to provide, and how long are they going to need to provide that care. When you're looking at designating an individual to be able to provide care under the program, it's worth knowing that our definition of family member is broader than what is available under the federal program. In fact, it includes affinity relationships as well as blood relationships. So you can see on our list that it includes all the same relationships that's covered under FMLA with spouse, child, parent, but it also expands that to include the siblings, grandchildren, grandparents, son-in-law, daughter-in-law, and this important last category of any individual who has a personal relationship with the applicant that creates both an expectation and a reliance that that applicant care for the individual without compensation. This is a fairly general category, but those three parts, that it's an expectation and a reliance for care without compensation, are really the key here. This definition does allow us to account for families that look different than the traditional nuclear family, but we do ask that healthcare providers ensure that relationship, that when they're approving somebody for providing caring leave, that they fit all three of those criteria, that it's somebody who's reasonably expected to take care of the individual who needs care. One of the differences between our program and the federal program is that our program also offers safety leave. Safety leave is a type of leave that supports survivors of domestic violence and sexual assault, and it covers situations where a person or their family member is affected by domestic violence, sexual assault, or stalking. Healthcare providers are able to certify that an individual is a survivor of domestic violence and sexual assault. We're not expecting, nor do we want, specific details of what happened in order to qualify them as a survivor. Rather, we're asking you to designate them as having experienced a domestic violence event that will require leave in order as part of their recovery. It can be used for medical attention or counseling, as well as to seek other services or manage legal or logistical issues associated with recovery from a safety event. So that's the certification part at a high level. The next major thing that we want to talk about is how healthcare providers can help educate and inform their patients about the program. We really value and are inspired by the work of healthcare providers across the state and know how much you care about your patients getting well. And we want to be your partner in providing care where it's possible under the program. And we want to help your patients learn about paid leave. And it's a brand new program. So with new programs, it takes a while for folks to learn that they have this available to them. We have a number of resources, both available on our website. In Danny's opening remarks, she mentioned that we have a ton of resources on the info.paidleave.mn.gov. But just today, we relaunched the healthcare provider section of our website that includes some updated resources specifically for healthcare providers as they get ready for the program. We also ask if you're able to hang an informational poster or be able to share documentation that we have about workers' rights in the workplace, as well as information generally about the program. We would love to work with you in getting this information to your patients when they need care. If you have questions about the program, if your patient asks you a question that you don't know the answer to about paid leave, we have a number of ways to support them. We have a contact center that's open from Monday to Friday, 8 a.m. to 4:30, except for state holidays. They can take calls in an individual's native language. We have access to Language Line, which allows us to be able to take in questions in over 100 different languages. This is important for folks that may face barriers to access to the program, whether it's reliable internet or access to a computer, limited English proficiency or limited literacy, or a disability or health condition that impacts their ability to apply. If you run into these situations, contacting the contact center, we're committed to helping folks access the program. Additionally, providing resources and support from your health system, and helping connect to community organizations offering assistance is really helpful as part of the healthcare provider role. So we've talked a bit about what it looks like to prepare for paid leave as a healthcare provider. Now I want to shift gears into what it looks like to prepare as a large, complex employer. Now, I previewed this at the beginning, but there's 3 major things that all employers across the state should be doing today to get ready for the program. Number 1, setting up your accounts, making sure that you have the right accounts set up with the paid leave program on day 1. Number 2, notifying your employees about the program. And number 3, setting workforce policies that allow you to customize how paid leave works in your workplace to make it an asset to both you and to your employees. Step 1 is making sure that you have all of your accounts set up. There are 2 accounts under the paid leave program. The first is an employer account, which is on the UI website. So if you are an employer that participates in the state's unemployment insurance program, this account has already been set up for you. The way that we did that is we took your existing UI account and we converted it into a joint paid leave UI account. So when you complete your wage detail report on a quarterly basis, that information is shared directly with the paid leave division in order to meet your wage reporting requirements. Starting in January of next year, this is the same place that you're going to go to pay premiums to fund the program. So through that same process, you'll be paying premiums through your employer account on the unemployment insurance website. If there are any employers here that also don't participate in the UI program for one reason or another, there's still a way to set up a paid leave only account. So you can share that information directly with the paid leave program while not enrolling into the UI program. So the first one, in most cases, is already done for you. You should already have an employer account today, but your next step is setting up your leave administrator account. Now, this is an account at paidleave.mn.gov that's meant to help you help administer leaves within your business. This is a tool that we've been building over the last 2 years with HR professionals across the state. And based off of their feedback, we know that employers are looking for transparency and actionable information to help them coordinate leaves while an employee is out. This administrator account is live today. The first step is to go into your existing employer account, into the roles, and to designate an individual or individuals from your workplace to sign up for an account with the paid leave program. If you're a large hospital system, you're able to have more than one administrator. You can have as many administrators as you want. Additionally, if you are a provider that's operating across multiple employers, you're able to serve as a leave administrator for one or more businesses. This functionality is live today. It's also where you're going to go to be able to, when an employee applies for leave under the program, a lot of the information that they provide to the division is shared directly with the employer through the administrator account. So being able to know when an application has been submitted to the division, know the status of that application, know if the person's getting payments from the division, if so, when, for what amounts, as well as if they're asking for reporting their time, if they're taking an intermittent leave. All of that and more is available within the Leave Administrator portal, and we really encourage you, if you haven't done so already, to set up your account today. This is a preview of what it looks like. When an employee files for leave, you'll get an email to check that there's an application for review, and we'll provide a lot of the same information that the employee provided during their application. That includes the number of hours that they work, whether or not you have been informed of the request for leave prior, the leave schedule, how long somebody is going to be out, whether the leave is continuous or intermittent, as well as if they're going to be receiving other payments from you as an employer during the course of their leave. And if instead you want to offer supplemental benefits to top off the benefit that they're receiving from partial to full wage replacement. This is also where we're going to track all of our payment information. So all that information will be available in the portal, as well as information to support tax administration for employers as well. So that's step one. You've set up your employer account and your leave administrator account. Step two is you need to notify your employees about the program. There's two separate notification requirements under the statute. The first is that you need to display a workforce poster in English and any other language spoken by 5 or more employees or independent contractors. This is a requirement that feels just like FMLA or a lot of other wage and hour programs. And this poster is available today in English, as well as multiple other languages on our website. So you can download those today and hang them in your workplace. The second requirement is that each individual employee needs to be notified directly in their native language about the program. Just this last week, we published a model notification of all of the information that you need to provide to your employees about the paid leave program in order to meet this requirement. It's important to note that employers need to complete this notification requirement by December 1st of this year, because it needs to be done 30 days before premium collection begins. So by December 1st, you need to make sure that all of your employees have been notified of the program. We do have a model template available. You're not required to use our model template, but it does include all of the information that you need to provide to your employees. One more thing before I leave this is that for those employees that you notify, it's important that you get an acknowledgement of receipt. Because if an employee tells us that they have not been notified about the program and that had some detrimental effect on their access to benefits, then that kicks off fact-finding on our side. And we need evidence that the employer notified the employee about the program. If an employee refuses to acknowledge receipt of this, you need to document how you attempted to notify your workforce. So that's a really important compliance requirement for January 1st. But after you've completed step one of getting your account set up and notifying your workforce, at that point, you're technically compliant for January 1st. You've done all of the things that you need to have in place in order to be successful on day one. But there are a number of other decisions that you can make as an employer that can help customize how paid leave works for your business. Some of these decisions include whether or not you're going to split that contribution equally, or if you're going to pick up more of the employee portion of the contribution for some or all of your employees. That's a decision that you get to make. Thinking about how paid leave will coordinate with other benefits. Simply put, almost any payment that you make to an employee can be considered either a supplemental payment or a substitute payment, meaning that you could decide to top off benefits or require people to use their PTO, sick and vacation time instead of receiving a benefit from the division. Again, that is a decision for an employer to make. Employers are able to enforce their existing leave and absence policies. They can require employees to talk to a specific person, send a specific email, call a specific number. As long as those policies are documented, an employer can enforce those, and we will also enforce those on our side through the application process. And then giving some thought to how intermittent leave is going to exist. The big decision here is that while leave can be taken in one big block or smaller blocks over time, the employer gets to decide how big that block is. Whether you want to allow employees to take leave in 1 hour increments, 15-minute increments, or full day increments, that's a decision for you as an employer to make. We have a ton more information about each one of these potential decision points available on our website on our Get Ready page for employers. One area that I do want to touch base on before we move on to the Q&A is tax responsibilities for employers and employees. So the IRS recently issued guidance on the tax treatment of both premiums and benefit payments from state-run paid leave programs. And the tax treatment of these, both the premiums and the payments, are important for employers to know because they do require action on your part. For family leave, the good news is that these payments are not counted as wages and they don't need to be imputed into a W-2, which means that the division will issue 1099s for anybody that takes family leave during the course of the year. So if somebody just takes caring leave or bonding leave, safety leave, military leave, we will take care of the 1099 at the end of the year directly to the employee who took leave. Medical payments are a little bit different. The IRS guidance is that the programs should be treated the same way that third-party sick pay works, which is, according to IRS guidance, the portion of the medical benefit that is attributable to the employer is taxable and needs to be counted as wages on that employee's W-2. We're going to put a ton more information about how that's being operationalized on our website in the near future, but we do already have a handout on employers and paid leave and taxes available on our employer toolkit. As part of the Leave Administrator portal, we will share all of the information that you need in order to stay in compliance with the IRS guidance around these benefit payments. On the premium side, a few quick facts. The premiums are collected on post-tax wages, and anything that an employer contributes, whether it's the required portion or discretionary pickup for the employee's portion of the premium payment, that is tax deductible, but it's tax deductible in different ways. The required portion is an excise tax. The optional portion is an ordinary and necessary business expense. Regardless, at the end of the year, the employee contribution and any employer pickup, this is the optional portion of the employer payments, needs to be reported in box 14 of the W-2, labeled as MNPFML. A simpler way of saying that is that 0.44% of wages needs to be reported in box 14 as MNPFML. Okay, the last thing, we're really dedicated to continuously improving and collaborating with all of our partners across the state. We want to know what's working well in our process, as well as where there's opportunities for us to improve. We share the same desire to be able to reduce administrative burden in healthcare wherever we possibly can, and we hope that you view us as your partners in doing so. We've been working across the state over the last 2 years to build this program, and we've done over 250 engagement sessions with a variety of different audiences, including healthcare providers from across the state. And we're continuing. Just because we're launching on January 1st doesn't mean that the program is done. We're going to continue to improve even after we go live in January. And we're looking for opportunities to work alongside providers to make this process the best that it possibly can be. Again, we really want to understand what's going well, how we can make paid leave more accessible to more people, and specifically, we're interested in ways to reduce administrative burden and make paid leave an efficient and effective tool for providers to provide patient outcomes. And we're going to be asking in the very near future for providers to get in contact with us and help us solve these problems, because we want to make this as great as we possibly can. Tons of ways to stay engaged with us. Our website, like I mentioned, has just been updated with additional resources for healthcare providers and for employers that are getting ready for the program. There's frequently asked questions that we've received from as well as the slides from today are now available on our website as well. We have FAQs that we get from sessions just like this, and we also issue a regular newsletter with breaking news for how the program is improving over time. You can also send us questions. You can either do that via email or through our contact center, which is available from 8 a.m. to 4:30 every day, Monday through Friday, except for state holidays. And that number is 651-556-7777. With that, thank you guys for your attention today. We're really excited about our future work together, and I'm going to turn it over to Danny to start off Q&A.
Thank you so much, Greg. Again, breaking news, y'all. The slides that you just saw are now available online. As we were speaking, they were posted. So that's fantastic. Thanks for that update, team. All right, we're going to transition over to the Q&A session now. Thank you so much to everyone that has submitted a question. If you'd still like to submit a question, keep them coming. Please do so. You can find the chat button at the top of the screen. It looks like a purple speech bubble with a question mark on it. A reminder that only you and our webinar team can see your question. And like I said, all of your questions are important to us, and we'll address as many as we can today, but there's quite a lot of them. I think we topped out at maybe 335 attendees with us today. So if we aren't able to get to your question, know that our contact center is ready to help you. Okay, I'll start off with a few of the pre-submitted questions that we got from the registration forms, and then I'll move into questions that are live in the chat. All right. So first question is about certification. When will certification forms for providers be available? And what is the program doing to make the certification process as simple as possible for healthcare professionals?
Great question. So we're going to be publishing our certification forms in the next 2 weeks. That said, like we mentioned during the presentation, for the vast majority of leaves, healthcare providers would be able to use the existing DOL forms in order to submit an application or in order to certify the need for leave. We're doing that as part of trying to make this as simple as we can for healthcare providers by leveraging processes that already exist. But we're also committed to partnering with anyone who wants to partner with us on making this process better over time and finding innovative ways to reduce the administrative burden on healthcare providers.
All right, great. This second question is also about certification. Will the medical certification content be the same if you go with the state plan as if you go with the private plan?
So I can't give a definitive answer on this because part of the private plans is that they also do have their own application process and their own certification process. However, we have been having conversations with all of the providers that have been pre-certified to offer insurance products in the state of Minnesota, and they've signaled that they would accept the same information that we're asking healthcare providers to provide. Just like under FMLA, like the FMLA DOL form is a model template. If an employee provides the same information in a different format, it's very likely acceptable.
Okay, great. Now this next question, we've gotten a number of people asking along this same theme of 2025 kids, all right, and parental leave. So one of these questions is, if an employee goes on maternity leave in December 2025, are they entitled to 12 weeks of leave starting January 1st, 2026?
Yeah, so this is a great question. So bonding leave can be taken within 12 months of welcoming a new child into your home, whether through birth, foster care, or adoption. When our program goes live on January 1st, that means that parents that welcome the child into their home in 2025 will be eligible to take paid leave up until the 1-year anniversary of welcoming that child into their home. Something to know here is that leaves that were taken previous to the program going live on January 1st can't be used to reduce the amount of leave available to a particular person. So parents could be eligible for up to 12 weeks of bonding leave.
All right. And this next question is about intermittent leave. Is there a waiting period before the employee starts receiving payments while on intermittent leave, or does it happen right away? How is this determined?
Yeah, so when you hear the words waiting period, I just do want to make sure that we're talking about the same thing, because under programs like short-term disability, there's often a waiting week that's unpaid. There's no such thing as an unpaid waiting week under the paid leave program. We do pay based off of absences on day one. However, under intermittent leave, we won't issue a payment until the applicant has completed at least 8 hours of leave or 30 days of leave have passed.
All right. This next question is about premiums. Actually, the next two questions are about premiums. First, is there a maximum amount per pay period or per month that one person could have deducted from their paychecks?
Yeah, so the max amount that a person could have deducted from their paycheck is 0.44. And that's true whether you work for a large employer or a small employer. Employers are able to deduct that much, whether they're paying 0.66 or 0.88. The maximum employee contribution is 0.44% of your wages, and that's up to the Social Security cap. So on wages above $176,000, the premium does not apply.
And there's a calculator on our website.
Good plug. Yeah, we do have a calculator on our website on info.paidleave.mn.gov. We have both a benefits calculator to see how much you would get during a leave, as well as a premiums calculator to see what this would cost you.
And that's for employers and employees. So very handy tool. Again, check out our website. All right. This is the second pre-submitted question about premiums. Okay. The sample leave notice. So that's the sample leave notice for employees. Has the premium divided between medical and family leave? The employer isn't supposed to pay less than 50% of the premium, but these are odd numbers in the sample employee notice. So how can we split these evenly between employers and employees?
So I'm going to answer this in a couple of ways. So, it's 0.88% of wages is due. And yeah, it can be split equally between an employee and an employer. That could mean that you're splitting it down to the, tenths, hundredth, thousandths. If it breaks on an odd number at the hundredths decimal point, that is the rate, that's the maximum rate that you would be able to pay. If it does kind of get to a point where it's a penny difference, the standard in the statute is that the employer must pay a minimum of 50%, so the employer would pay the penny.
Ooh, we're getting into decimal points. All right. This is the last question from the registration forms that we'll do, and then we're going to transition to the live questions from the chat today. This is about the localization question. What happens for out-of-state companies? So someone asked, we have an employee that works remotely in Minnesota or a company in Alaska. Are we required to participate in paid leave?
Great, yeah, so getting back to our localization test, it really depends on where the work is physically happening. So in this case, where the employee is working remotely in Minnesota for a company that's in Alaska, since the work is physically happening in Minnesota, this individual would be covered under paid leave and should have premiums paid on their behalf.
All right, great. Thank you, Greg, for answering those pre-submitted questions. Now we're going to transition over to questions from the chat. Thanks again to everyone who has submitted a question here today. If you'd still like to submit a question, please do so. Again, that chat button is at the top of the screen. All right, so let's get started here. We've got a lot of questions from folks today. This first one is, all right, how far retroactively can leaves be approved?
Okay, yeah, so leaves can be approved. Okay, so this is kind of an interesting question because it gets down to when a person is applying for paid leave. We, as a general rule, say that employees can apply up to 60 days prior to going out on leave, and we encourage them to do so. And they also are required to notify their employer prior to applying to the division in all cases. In cases where that 60 days or like a reasonable amount of notice is not possible, like you're incapacitated suddenly and you're no longer able to apply in a timely manner, we will automatically be able to retroactively pay for 1 week of leave. However, if you're incapacitated for a longer amount of time and through no fault of your own, you weren't able to apply for the we would be able to backdate it further based off of the fact that you were not able to do so, but we would have to prove that you weren't able to apply timely.
Okay, great. Someone else asked, does paid leave end or kind of cancel out earned sick and safe time?
Earned sick and safe time and paid leave are two distinct programs. Earned sick and safe time is really for day-to-day absences, similar to vacation, sick, or it oftentimes is vacation, sick, PTO, and it's used on a more episodic kind of day-to-day unexpected absences, going to a doctor for the flu or something like that. This is a distinct program. While ESST is administered by DLI, the paid leave program is administered by DEED. We actually have a comparison chart of the differences between paid leave and ESST that's available on the employer toolkit as well.
That is a really handy comparison. It really breaks it down easily between ESST and paid leave. So I think probably our colleagues will be putting that link in the chat to that explainer. All right, so next question from the audience today is about using medical and family leave in the same benefit year. So someone asked if someone uses up their full 20 weeks of medical plus family leave in one benefit year, but then finds out they need more time due to that same medical issue, so that issue's lasting longer and they've already exhausted all their 20 weeks of paid leave for that benefit year. Could they transition to long-term disability if the company offers it, or are they just out of luck?
Yeah, this is a great question. So in the case where, so like we mentioned, you're eligible for up to 12 weeks of family, 12 weeks of medical. If you take both, it's up to 20 weeks within a benefit year. Time above and beyond that 20 weeks no longer will qualify for job protections or payments under the paid leave statute. The terms of a long-term disability program are kind of outside of the scope of how the paid leave program operates. So it would really depend on the plan that you would have available.
Mm-hmm. Okay. This next question is about the weekly benefit payments, the weekly payments that come from the state when someone is on leave. So this person asked, will employers be able to see that weekly payment amount that employees are receiving while they're on paid leave? And if so, will it be listed as hours or a dollar amount?
Yeah, great. Yeah, so we will, both as part of the determinations process, we will put out an amount that we're paying, a weekly benefit amount on that document when somebody's been approved for leave, so you'll know how much we're paying on a weekly basis. But if you get an account with if you designate a leave administrator and they set up an account with us at paidleave.mn.gov, they'll also have access to payment information, where you'll be able to download a CSV of all the payments that we make to your employees. That's available as soon as those payments are processed. This is important for tax administration purposes, as well as being able to coordinate benefits within your business. Additionally, if an employee is out on intermittent leave, they also they have a weekly reporting requirement under our program. So they will need to tell us how many hours they used during the week, and then we'll send that information to the employer to verify as well each and every time that an employee reports time taken.
Okay, great. And just another reminder for folks, create that paid leave admin account if you haven't already. All right, the next question here. Okay. This is about health insurance and the employee portion of, health insurance while on leave. So this person asked, how will employers receive payment from employees for health insurance when the state is when it's the state that's paying the employee during their paid leave? Essentially, how do you collect the employee portion of their health insurance premiums while that person's on leave and not getting paid by their employer?
That's a great question. So there's a few ways that we've seen this work in other states. One is the employer waiting until somebody comes back and recovering the amount that they would have paid from the employee. Others, we've seen the state of Massachusetts, if you would take a paid leave, they would require you to write a check up front for the full amount of the health insurance, your portion of the health insurance premium. Additionally, you could offer supplemental benefits, or if an employee chooses to use their paid time off during the course of the leave to get full wage replacement, you can use that to offset, and you can take the premium out of that. One that's kind of interesting is because most of the time employees are required to talk to their employer ahead of time. And if it's a planned leave where they know that somebody's going to be out ahead of time, you can get consent from the employee to pre-fund the insurance contributions ahead of time and maintain that tax advantage status.
All right, great. So there's a couple different ways folks can do it. Good to know. All right. We're going to go to the next live audience question here. We have a question about certification, the certification forms. So for the paid leave certification, will the state provide the forms to the employee, or will the employer do that?
Yeah, so in terms of getting access to the certification document, it will be available for download on our website. So the applicant will be able to download that, or the healthcare provider could if they're in the office as well. Or they could have copies printed out if they wanted to use those. But it would be the employee providing it to the state as part of their application for leave. One thing that's important to note is that we are not able to share the certification document that is submitted by the applicant, but the employer has a separate right of action where they can request any certification document that's been provided to the state as part of an application for benefits. So you would need to get the certification doc from the employee.
All right, great. So we also learned there the employee sends the certification form to the state, and then the employer can request the certification form from the employee. All right. Let's see here. The next question. Oh, but that was actually the next question. I think, Greg, you even got ahead of me. The next question was, will the employer be able to view the certification that's submitted by the applicant? And like Greg said, that's something that the employer has a right to request from the applicant. All right. So this next question, does a new certification have to be submitted for family leave after medical leave is complete for birth of a child? So essentially, if you give birth and you take paid medical leave for that, do you also have to submit another certification for the family leave side of that, the bonding leave?
Yeah. Okay. One really cool thing is that we're going to be the first state in the country to have a single application for folks that want to apply for both birth and bonding leave. So if you're a new parent, when you apply, you'll only have to apply once to be able to access both pregnancy-related medical leave and bonding leave. That said, they are different types of leave. One's medical, one's family, and they have different certification requirements. So as part of that application, will first ask for the healthcare provider to certify the amount of time that the individual needs, which could be 6 to 8, or whatever amount of time that the individual needs to recover from the pregnancy, depending on the specifics of their case. And then once the child is born, the parent could then upload a letter from the discharge papers or a letter from their healthcare provider that shows the date that the baby was welcomed into the home. So it is separate certification requirements, but they don't have to be submitted at the same time. You could start your leave. You could need prenatal care and start your leave before the baby is born, and then transition into bonding leave after the child is born, and by just uploading the letter or discharge papers.
Okay, great. So single application with different certification requirements, and you can start it before the baby's born and update it after the birth too. Okay, fantastic. Let's go to the next question. What do we have here? Okay, so this question is about intermittent leave. Okay. Can a person's paid leave change from full-time or continuous, I think is what they mean. Can you go from continuous leave and change to intermittent leave?
Yeah, so this is a situation that happens where somebody is taking intermittent leave and then the facts of the case change and they need to be out for a continuous period, or vice versa, that they may be able to return to work part-time and they only need some time off instead of the full time. Out of the gate, this is going to be 2 separate applications. So changing your leave schedule will require a separate application, because we will need the certification document that says the correct amount of time that the person should be out. We are working, we are committed to making this longer term, less frictional. So we're trying to improve the process over time, but out of the gate, it will be 2 separate applications, but you could do it.
All right. All right, I know we've got a few minutes left here, so I'm going to take a few more questions. This one is about, again, about birth bonding or birth and medical leave. This person is wondering, how much flexibility does a provider have in deciding how much time a patient needs to recover from pregnancy? Are providers restricted to recommending 6 weeks for a vaginal birth and 8 weeks for a C-section?
Restricted? No, not necessarily. We know that there are the unique facts of the case matter. There may be somebody who needs more than the 6 to 8 weeks. There's nothing that prohibits a healthcare provider or hospital from setting a standard that they normally work through, but there is room for exceptions where if you have somebody that's particularly time than that if verified by the healthcare provider. So they're not restricted. We don't have a particular time period, or we don't pre-certify particular conditions as needing X amount of time. Instead, we rely on the healthcare provider to provide that.
Right, thank you. We're going to switch gears a little bit here to caring leave. So that's when you're caring for a loved one. This person asked, for caring leave, does the family member need to reside in Minnesota?
Great question. And by family member, do we mean the person providing care or the person receiving care? I'm going to guess that it's the person receiving care, not the person providing care. Mm-hmm. Because the person providing care, they would be subject to all the eligibility criteria. They would need to be providing services in covered employment in order to qualify for the benefit. But for the person that's receiving care from a Minnesota worker, there's no restriction on them living within the state of Minnesota. With that said, we do have part of our rules where if you're outside of information from that healthcare provider in order to verify the veracity of that certification.
And I don't know about for other folks, Greg cut out just a little bit at the end there. Can you repeat that last sentence?
Yeah, if you're if it's an out-of-state or out-of-country healthcare provider, we will ask for additional information in order to verify the certification.
Got it. Okay, great. Now this next question, back to bonding leave. Back to bonding leave. This person asked, can grandparents take bonding leave, even if they're not the infant's guardian?
No, they would not be able to. So bonding leave is only for the parents. So it's only for the birth-giving and non-birth-giving parent that's listed on the birth certificate or adoption certificate, foster care certificate.
Okay, great. And this next question is one we get pretty frequently. It's about payments from the state while a person's on leave. Someone asked, do you have an estimate of about how long it will take for a patient to start receiving pay from the state? I assume they mean once the application is approved.
Well, I think that's an important variable on this. When the application is approved really depends on when the applicant applied. If you applied before going out on leave, our target is a 2-week adjudication turnaround for an approval or denial, and then we would pay on day 8 of the leave. If you apply after you're out on leave, depending on if you've been out for more than a week and then you apply with the state, we still will try to turn that around in 2 weeks, but then we will pay almost immediately after the approval has gone through. I think it'd be the next day or the day after that.
All right, great. Thank you for that nuance there. I'm going to ask one more question and then we're going to start wrapping up. So this person asked about paid leave and FMLA and how those work together. So they said, can we require an employee to apply for Minnesota paid leave if they also apply for FMLA leave? And if not, what happens if an employee takes 12 weeks of FMLA and then after that applies for 12 weeks of Minnesota paid leave?
Yeah, so employers under our statute are allowed to run paid leave concurrently with FMLA. So if somebody's eligible for both FMLA and paid leave at the same time for the same condition, those 2 time allotments can run concurrently. Although there's nothing that would prevent an employer from setting a policy that if you have an FMLA related event that you need to apply to paid leave, there's nothing that prevents you from having that policy. But there's also, you may not need to do that. That leave could still count towards their overall leave allotment.
All right, great. So it is almost 4 o'clock. I want to be respectful of everyone's time. So we're going to wrap up by asking for your feedback on today's webinar. You see a QR code on your screen right now, and we'll put the link in the chat as well. This is a feedback survey, only takes 1 to 2 minutes, and it helps us understand what worked well and what can be improved. Now, as I mentioned, if we didn't get to your question today, please visit our website where you can check out our info pages for providers, employers, and employees. There's a lot of helpful information there. And as always, our contact center is here and ready to help you with any and all questions. Just fill out the form online or give them a call. All right, and as a final reminder, the slides from today's webinar are now on our website. Go to info.paidleave.mn.gov and check out our public events page for those slides. All right, so thanks again to everyone who joined today and to the Minnesota Hospital Association for co-hosting this webinar with us. Now I'll hand it back over to Danny Ackert from the Minnesota Hospital Association for some closing remarks.
Thank you, Danny. Thank you, Greg. On behalf of our members, the hospitals and health systems across Minnesota, I want to just stress, and I'll also take the privilege of speaking for all the other non-hospital based healthcare providers on this webinar, that the healthcare workforce at scale is under incredible stress. And so I think I want to impress upon Dee, I know you know this, but I need to say this, that running up to January 1st, there's still, I think, a lot of unknowns because we don't know what this is going to look like in practice as we implement this within each hospital and health system and other types of providers. I want to make note that I have gotten a lot of texts that we're in need of a little bit more detail on the certification process, especially on the expectations that patients might have versus what providers might have in the number of different hypotheticals that exist for how patient care is delivered and when that certification will be initiated by which party or not. So I just want to stress that at the end. But I will end with, I want to again thank all of our MHA members for being here and other healthcare providers for being on this line. We're going to have to work together to help implement this starting January 1st. And again, thank you to Greg and everyone at DEED for engaging with us over the last couple of months to get this set up. And we look forward to continuing to help this improve before and after January 1st. All right, everyone. Perfect. All right, thank you, everybody.